have a wonderful audience here. I'm Augusta Saulys. I'm one of the docs in the emergency department, and it's not good to start lectures like this with a disclaimer, but one has to start with a disclaimer in that it may be my ignorance that allowed me to volunteer to give this lecture, because this is a topic that is extremely complicated, and I'll be first to admit that I do not know a whole lot about it. But I did study it for about 6 months, and Dr. Bell is here to support me because he's the second person taking that same course, which is now one of the few courses for physicians in this country. It's run by a physician named Joseph Helms, who is here from Berkeley, but teaches the course in Maryland and Arizona. And a lot of the things that I'm going to talk about are really based on what I've learned in the course. So the few areas that I thought we would talk about is a little bit of the history, some of the science, such as it is, a little bit about the paradigms that underpin acupuncture, which are of course based on Eastern philosophy and are very different for us. And then the last thing, maybe the most relevant on a practical level, is where we might want to see this go here at Children's. So let's talk about the history. So long and very complicated. But basically, thousands and thousands of years ago, we all probably have an idea that this started in China through the various dynasties. And people have seen things like, digging up well-preserved frozen corpses and seen various marks on the body, particularly on the ear, that suggested that people knew that using certain acupuncture points, for example, for back pain, helped, so it has a long history. But we, in the Western world, probably know about it mostly through our trade relationships that started to develop in the 1600s, and also through the missionary work. The Jesuits were very curious about other cultures. They tried to convert everybody to Catholicism, but they also were very curious about what was happening in the places that they worked, and they were among the first to appreciate acupuncture for what it was. The British started their opium wars in China, also sent a lot of troops, a lot of physicians there, but probably the biggest thing that influenced our Western understanding were the French who went to Vietnam and to Indochina. And those physicians in those hospitals learned acupuncture, studied it, such that in French medical schools in the 70s and early 80s, it was part of the discipline. The reason it fell out of favor, according to our teacher, Dr. Helms, is because the French government recognized that acupuncture was a very valid way to treat pain. So the French government said, great, we'll pay for it. But the payment, like with all governmental systems, became less and less and less, and yet acupuncture treatments need to have a certain duration. And so pretty soon it was no longer worth it for a physician to get a government payment and spend half an hour working with the patient. And so by the mid-1980s, interest in acupuncture in France even died down. But France was the biggest place in the 1960s and 70s where Western physicians truly studied and did research on acupuncture topics. We probably all remember, maybe you don't, you guys weren't even born. In the 1970s, there was a reporter who went to China to report on the ping pong match between the Republic of China and the People's Republic of China and the U.S. And he developed appendicitis. His last name was Reston, and his post-op course had no analgesics except for acupuncture, which was very satisfying. And he came back and he wrote an article for the New York Times, and suddenly the U.S. became interested in it, and then Nixon did all his stuff in the 1970s with China. So in the 1980s and 90s, things were on the wane, but you know, countercultures like here in Berkeley, especially California, where lots of Chinese immigrants lived, there was a persistent interest in acupuncture. And in the present day, you know, we know that with narcotic addiction and everything else, there has been a government push from the FDA, the CDC, the NIH, and the Joint Commission that since January 1st, 2018 requires all hospitals to have some kind of non-narcotic approach to pain management. So I think we've gone a kind of the full circle to not acknowledging it in the West at all to now having some mandates. And that's why I think people like Dr. Bell and myself and you are probably interested in some of this stuff. So I guess acupuncture rests primarily on the whole concept of pain and sensation. And what happens when you get a nail in your hand or you sense a little feather, you have your myelinated and unmyelinated nerves. The myelinated nerves are a little bigger, they've got a little insulation around them, and therefore they transmit very quickly. The unmyelinated nerves are the slower, the more boring, deeper kind of pain, transmit a little more slowly, but they all transmit through the dorsal spinal columns up to your brain, through the brainstem, and into that red thing, which is the thalamus, which allows you to perceive pain. In the process of this transmission is not just electrical current. The electricity is carried through a number of various proteins and peptides and hormones that are secreted at the same time that you have this painful sensation or this light touch sensation. You know, we know, I mean, they have all these various chemical names, and those sorts of things have been studied physiologically. What we are having a harder time figuring out is how acupuncture enters into this. We know that there are certain points in the body that have a little depression. That's how an acupuncturist feels a point. You know, they develop very good senses of touch. They can feel along the surface of your body. They feel a little area of depression. This area of depression has been studied and is shown to have very little resistance compared to the surrounding dense tissues that are like right here. And because there's very little resistance in these areas, they connect, they transmit current or immune modulators or these other chemical peptides much more easily and much more quickly. This is the description of an acupuncture point, again, a result of work in the 1960s by some French people. And these acupuncture points supposedly overlie this tree-like winding structure that's composed of a big lymphatic, of nerves, of veins, and of arteries that all kind of intertwine, and together they transmit a current. And when they looked, apparently acupuncture points are 5 millimeters or so in width. And so if you press right here, all the signals that are produced down here immediately conduct up to 10 centimeters per second to the central nervous system. If you press over here or introduce a needle here, the conduction is not nearly as fast. I mean, I think I'm making it sound like it's you know, definite science, but I think it's a lot of speculation that seems to make sense. This next slide, it's impossible to read, but basically says what we kind of just talked about. What I do want to say, though, is we do know that acupuncture has something to do with the nervous system because people who have severed spinal cords don't respond to it. It does have something to do with endorphin production because if you give someone Narcan, you also don't get a response to acupuncture. So we have, certain concrete pieces of evidence that show that there's kind of a physiologic basis for all of this. The other aspect of acupuncture is sort of the science of electricity and electrons. We kind of know, I'm kind of looking at my notes here because there are important things I don't want to forget. We know that opposites attract, and in terms of electrons, negative and positive, like if you have a positive electron, it's going to be surrounded by negative electrons and vice versa. And it's been studied that an acupuncture needle, which is usually stainless steel, and it has like a little winding thing of the same metal around it on the top, about half or a third of the length. If you insert it into the skin, the needle part is going to be positive, but the top part is going to be negative. And if a little further off you insert another needle, you can, by heating it, make the current, or by twirling it, make the current go positive to negative. So that's how things are supposed to work. In a lesion that's hot, like infected, or and we'll talk about the significance of all of these, the feeling is that you have you want to get rid of that heat, and the way you disperse it is by putting this needle in, and electrons are negative, so you get rid of the electrons by going out of the handle. If you want to strengthen, give more electricity, you heat this end, then this becomes relatively negative, and you introduce electrons there. So it's, I'm probably not explaining it exactly right, but it is kind of apparently a simple physics process. The Chinese, however, did not write about electrons and neurohormones or peptides or anything like that. They had sort of three philosophical ideas that were the underpinning of acupuncture. And one is the whole concept of yin and yang, which is symbolized here. The other is the concept of qi, or the vivifying force of life. And the third is the fact that everything in life is somehow identified with 5 elements. So the first thing that we'll talk about is the qi part. So what do we notice about this particular diagram? So, sometimes I picked this one, obviously you look up on Google and you look yin and yang, okay, and you get a whole bunch of various pictures. What you notice, or for me here, is that yang is usually the top part, the dominant, the masculine. Yin is the female, the lower, the softer, but you notice that both yang and yin have light and dark. So what this means is that it's all relative. Everything can be described in terms of yang or yin. Traditionally, okay, like yin, interior, quiescent, soft, flaccid, nighttime, winter, cold, dark, dense, hard, heavy. The organs that are traditionally associated with yin are the solid organs. They are the zhang organs. I don't know how to pronounce that. Some people might do it better, but that's like the liver, the heart, the spleen, the kidney, the lung. Versus the yang, expansiveness, superficiality, the midday, heat, exposed areas, and then organs that are tubular, that are responsible for transport, like gallbladder, small intestine, stomach, large intestine, and bladder. I mean, this doesn't make a lot of sense in terms of our own understanding of physiology, but we're talking about the understanding of the Chinese in there. So what they do is Chinese medicine tries to understand illness in the way of yin and yang. So fever, is that, what do we think? Heat, right? So it's a yang condition, probably. What about a burn? Also probably, right? What about a cold? Yin. What about fatigue? Yin. What about sepsis? Yang. What about renal failure? Could be yin or yang, really. But you know, it's usually a more chronic thing. What about a sprained ankle this afternoon? Yang, probably. What about sprained ankle 2 weeks ago? You know, it has yin-y elements to it, right? I mean, you know, it's kind of, what about cancer? Again, the lymphoblastic crisis in a new patient, that's probably yang. But the cancer this is just understanding of diseases and how we would, what about the pain crisis in a patient with sickle cell disease? Also probably yang, although there's like chronic stuff going on, so the person may be depleted, has some yin elements. What about acute asthma? Again, you know, you could see that all of these things, maybe predominantly you can classify them yang or yin, but they have an element of the other too. However, in Chinese medicine, one of the primary things you have to decide is this illness primarily yin or yang, and how, if it's yin, I have to give it a little more yang to make it balanced. If it's yang, too hot, I have to get rid of some of the heat and make it a little more yin to make it balanced. So that's kind of the basis of this. Michael, do you want to say something? No? You pipe in when you... Okay, so that's the yin and yang concept, underlies everything. The second thing is this concept of qi. I think the least religious affiliation kind of word to represent it is energy. But, you know, the Jesuits called it spiritus, the Sanskrit calls it prana, you know, Greeks called it pneuma. The character actually stands for two things. The lower part of this character, I don't know where the lower ends and the top starts, is supposedly rice, which is the food that you eat and, you know, your nourishment. And the top part is vapor, so it becomes, you know, that your food makes you live, and that's qi. There are various subsets of qi, wei qi, rong qi, wan qi. Wei qi is the protection on the outer part of your body, the thing that, you know, prevents you from being injured in the environment, prevents you from getting a cold. Rong qi is the nourishment qi, the thing that nourishes your inner organs. Wan qi is what you were born with, your genetic kind of potential or your genetic, and what you're supposed to respect and not, you know, live too hard, you know, eat badly, drink too much, you know, that kind of thing. So qi is a general term. It underlies everything, but it is the vivifying force. And you know, when you do a physical exam on someone or you walk into a room, you know right away whether that person has strong qi or not. You know, the little kid whose vitals are normal, but he just looks out of it, versus, you know, the one who has a fever who's like running around tearing the room apart and looks better than his parents do. You know, that kid has great qi, and you know it when you see it. So now I'm going to try to talk about something that, you know, I don't understand totally myself. So this is, you know, I'll have to admit. But so we're talking about qi, we're talking about yang and yin, And we're also going to talk about kind of how energy flows. In Western medicine, you know, you see the anatomy books and people are like this. In Eastern medicine, the anatomic position is different. It's like this, because this is supposed to be heaven, it's yan. My feet are on the earth, it's yin. And the energy flows from my feet up to the top, down the backside of the body. The front of the body, the soft, the nurturing, the, you know, parts that you don't want the other caveman to spear you in are yin. The back, you know, all your muscles, your spine and everything, that is yang. And that's the way the protective, or the way the energy flows in Chinese medicine. And the way they've characterized it, you know, the whole surface of the body is divided into subcircuits. The ones flowing in the front of the body are yin. The ones flowing in the back of the body are yang. And they have various elements that are peculiar to them. And this guy, basically these little colored lines only on one side of his body are all symmetrical, and they represent the areas of decreased resistance, or the acupuncture points where you can find areas of decreased resistance periodically that have been reproduced and discovered probably by hit or miss over thousands and thousands of years in China. And they represent the principal meridian subcircuits. And you've got 6 of them. You've got 6 on the front, 6 on the back, you know, the way they go up and down. And it's thought that in evolution, you know, when you have a little embryo, it's easy to see how these things evolve, and then it gets complicated as you get your limb buds, you know, and these things kind of circulate out into different places. But basically, you have 6 on the front, 6 on the back, and these are the names of the axes. The most masculine, the most one on the back is called Taiyan, and that Tai just means high, and the most feminine on the front, the one right in the middle, is Shaoyin. That's Shao means the smallest or the least. The ones in the middle kind of are in the middle. They have certain philosophical representations, and the ones you can see Yang Ming and Tai Yin are kind of a little more on the side. Tai Yin means maximum or strongest yin, and you can see that this axis here is kind of, it's already going to the side, so it's the least feminine of all the axes. Anyway, you know, this is one set of energy subcircuits, and this is like the most common thing that we know of in acupuncture. It's the principal meridians. But there are about 5 or 6 others, and I'm just going to talk to you about it. Anyway, this is the names of the principal meridians, and you can see, I mean, somehow these things are connected from Western medicine, but how does the heart connect to the, I mean, you know, it doesn't make physiologic sense, really. Liver, gallbladder, yes. Master of the heart, triple heater, they're not really physiologic concepts. They're more like the autonomic nervous system, parasympathetic and sympathetic nervous system. Spleen and stomach, you can kind of see they're digestive, but lung and large intestine physiologically don't make a lot of sense to us. However, when you study this, eventually it evolves into making sense. Let me just see where we are here. Okay. So you've got the principal meridians. That's one way of looking at it. You've got these other things called tendinomuscular meridians, which are kind of, they're basically over the surface of the principal meridians. They're just wider and they're very superficial. You've got the Shu Mu subsystem, and you thought it was just a Chinese food. It's basically deeper into the organ systems. Then you've got the distinct meridians, and this is really only for your organs. And then you've got this system of curious meridians, which are the homeostatic system that balance the energy of all the others. So you can imagine it takes years to learn this stuff, really, and to understand this. And I think most of us probably can get comfortable with the first 2 or 3 systems and maybe leave the rest to the experts, but it's fascinating nonetheless, and it's all interconnected. Anyway, okay, so we know about these systems. So how do people decide what needles to use, where to put them? Well, every one of those subsystems, the tendinomuscular meridian subsystem, the principal meridian system, the distinct meridian, has different formulas or different ways the needles need to be put in. For example, you know, if you have a burn on a particular part of your body, like say it's like right here. So what you would do is you would use the tendinomuscular meridian system, and the formula for that is using the ting point, using the gathering point. You know, how is that related to the hand under the eye? It's not. And then putting needles around this particular area. That's the formula for accessing this surface area. If you have a kidney problem, you use a formula that's specific for the distinct meridians, and it's a particular formula. It's putting points on the back of your knee where you have the kidneys and another point higher up. And again, so that's why, you know, we go to an acupuncture and you're like, well, I just told you my, you know, little finger hurts. Why are you putting the thing right here? Well, it's because it's an established formula based on where all these areas of energy flow. The other thing is what people do is they also put extra points in that make a little more sense, exactly the area that hurts. Any comments about that? I know it probably doesn't. Michael? No? Okay, all right. All right, so yin-yang, the qi thing, and the various flows of the energy. And then the last thing is the 5 elements. And so everything in the earth also is divided into 5 elements. And the 5 elements are fire, which controls several organs, earth, which is a very balanced, controls several organs, the spleen and the stomach, metal, kidney, metal, water, and wood. And people who really get into this stuff actually characterize personalities based on this. And this is where the philosophy of acupuncture is that it's not the disease that you're treating, so you don't treat every gastric reflux the same. You treat gastric reflux in Scott differently than you would in Deb, because Deb may have elements of the wood personality, and her physiology therefore would require a different input than Scott, who may be a fire person and need a different. And I find that pretty fascinating, because we do have kind of a rote, you know, we just write out the prescription for the person and don't necessarily get to know the rest of them. Of course, in our situation, it's also hard to do. It's a different kind of medicine. But this is essential in the philosophy of true acupuncture, is that it's very, very individualized, and it's based on this knowledge of different elements. Okay.
What do the times have to do with different elements?
So they are the Rong Qi, the energy that circulates, starts in the liver at night, supposedly nourishes the organs, and there are times of maximal and minimal activity. So you might be saying to the doctor, you know, I get this terrible upset at I don't know, 3 a.m. or something, like right where the liver is. And so the doctor would then kind of decide, well, I need to get some input for the liver, even though you don't know that your liver was involved, or it may not be obvious or something like that. So there are certain times that are typical for particular organs. And this is where, you know, when those of us who take the course and we're Western trained, you sort of, well, you do have to suspend a little disbelief with it. But, you know, I'm sure there's something that is true about it. Yes?
I think I've heard that, like, the most common time to have heart attacks is when your chi in your heart area or whatever is lowest, and like from 3 to 5 a.m. or something is.
Well, that could, I mean, and this would be the highest time is 11 a.m. to 3 p.m. So that would be 11. Yeah, that would be 3 a.m. to 11 a.m. Yeah.
In October 2017, there was a Nobel Prize given for clock genes, and they talk about the times of the day when the liver's non-coding DNA and the non-coding RNA and DNA are opened up and are expressing themselves. And the clock genes have cycles that actually correspond quite well to this.
Wow.
If you look here, the lung is the area at the time that you were just mentioning from 3 to 7 a.m. So it is that time that is feeding from the heart.
That's interesting.
Which is why
The heart is at its weakest because it gives the lung.
Well, it's very interesting. I mean, it's interesting that we are finding out, because people have done this for thousands and thousands of years just by chance. So it's very interesting.
I don't think it's chance. I think it's practice-based.
No, of course. No. They have tried something, it worked, but over generations and generations.
Well, they watched it. The things that didn't work got tossed aside, and the things that worked continued. And various people that were practicing were noticing similar observations, which is what science is, and then the observations were culled and vetted and put together to create a system.
Yeah. Well, and so anyway, this is the third essential arm of Chinese medicine. So I am going to digress a little bit, and anybody have an idea about fractals? So fractals are kind of geometric repetitions of patterns on a large scale, on a small scale. This is a snake skin, and you can see, you know, kind of, you look at it from further, you look at it closer. This is a pictorial rendition, but nevertheless a conch shell. These are cacti. And this is meant, maybe it's a stretch, but you know, just like you have big and small in nature, you also have it on our body. So our brain has the homunculus, you know, the rest of our body is represented on the surface of the brain. In Chinese medicine, the body is also represented on the tongue. Various parts of the tongue represent different parts of the body. And this is a complicated science in and of itself. In Korean medicine, you can barely see this because I've magnified it, hand acupuncture, acupressure is very important because various parts of the body are represented on the hand. For us, however, particularly we'll talk about the Idi acupuncture, the homunculus in the ear is probably one of the most useful applications of acupuncture that we'll have, and a fractal kind of in itself. The whole body is represented in the ear. Auricular acupuncture has always been recognized as a great place to do acupuncture because obviously you can get to it. You don't have to undress the person. You can find points that are tender or give off electrical currents. There's actually these little point finders, which can be not only therapeutic but also diagnostic. You can find things that are going on. It's not difficult to learn, which is why the Air Force has started to teach its medics that since 2001. It's been going on for a very long time, and it's pretty useful also for children because you don't really need to use needles. You can use little beads, seeds, and in older people you actually can use needles and little ear clips. They're called asp needles that look like little gold earrings. So that is probably something we're going to be doing a lot for. And you can see that, like, if you take upper limb, these areas, you can see here's the upper limb, there it is. So needles that you would place would be right here. If you had a problem with the leg right here, so needles go in that area. Similarly, head and face, dental pain, stuff like that, needles go in that area. The protocols that have become famous are the auricular trauma protocol or battlefield auricular acupuncture. The battlefield protocol was developed by a physician named Richard Niemsau in 2001, and he was responding to all the soldiers in Iraq and Afghanistan who were getting acutely injured, and they wanted these people to be able to walk out, provided their leg wasn't blown off, but if they had some other injury. And instead of giving narcotics, they taught their medics how to use this battlefield auricular acupuncture in a certain order, putting those on. The ATP protocol is a modification of that. The NADA protocol is for addiction. And these things have been found to be very useful. Okay, so that's, so we talked about the three things. We talked about, focused a little bit on auricular acupuncture, and just a little bit about the research. So research is hard to do in acupuncture, and one of the reasons is because even if you stick a needle into a sham acupuncture point, you are going to have some kind of reaction in the body. So most of the studies, therefore, are not really randomized controlled trials. They are suboptimal, and they consist of people reporting the decrease in pain scale. This also means that the people who participate in these trials have to be verbal. So you're talking about people 8 years of age or more, and it's just hard to have an objective result. When you don't have objective results, it's hard to get buy-in from insurance companies to pay for procedures, and it's hard to get buy-in from hospitals to fund these things, or any institution. So there's always going to be a difficulty with this. The place it's truly helped has been substance abuse. Other conditions that it's been very helpful are in China. It's used extensively for for lots of ENT things, dental extractions, thyroid surgeries, things like that. There's one paper that recently came out by a doctor who's a physician, a PEM, pediatric emergency medicine doctor at Columbia, Dr. Tsai, and she had 25 or so patients, all of whom were over 8 years old, and she treated various pain conditions in the emergency department. So I have to say, clinical research is not very robust, but because of the limitations that we talked about, but it doesn't mean we shouldn't keep trying to do stuff like this. What are the complications of acupuncture? Well, you can imagine pneumothorax. I think most people who've had anatomy would be very careful in the chest area, so it's actually pretty rare. Hematomata are usually not common unless someone is anticoagulated. Infection is very rare. In fact, in our class, nobody bothers to clean off with alcohol, although I would say people in their offices who do acupuncture professionally usually do. You can induce pregnancy with this, so it is important not to make sure the person isn't pregnant, especially if they're late term. But the most common cause of malpractice for physicians is a delay in diagnosis. So, you know, treating a pain condition for a little too long when maybe the person should have had a CT scan because their symptoms suggested something more ominous. So I think, you know, looking at this, we can see they're not very common, and they occur maybe when we expect a little too much of the discipline. Any comments about this? Our malpractice provider for physicians at this hospital insures us with no problem. This is from the Department of the Acupuncture Board of California, the Department of Consumer Affairs. So in California, who can perform acupuncturists? Anybody who has an acupuncture license and physicians who are licensed by the Medical Board of California. So you residents, once you're second or third years and have your license, you theoretically can take a bunch of needles and do acupuncture. Obviously, in this hospital, like many hospitals, you know, we're not, I probably could theoretically do an appendectomy too if I looked at a book but we have to get credentialed. So we have to go to the credentials committee. We have to say, we took this training, you know, they kind of check it out. We have somebody proctor us, and then they say, yes, you can do acupuncture. But you should know, some states you cannot do acupuncture unless you do various courses. But in California, you can. So that's kind of an interesting thing. Okay, let's go to our next thing. Where is the next one? And you know it's supposed to be behind this.
That's right.
Okay, I
Go
see
down
it.
to
I
the
see
bottom.
it. It's right there. Wait a minute. Okay, all right. So, you know, what's the plan in our emergency department? So one thing is training for physicians. So Dr. Bell is taking the course. Dr. Ken Zuckerman of anesthesia has already taken the course. Dr. Wen Dong, who worked in Annex and now kind of flies back periodically, has taken acupuncture. Jen Matthews is planning on taking the course. I think Eddie Chu is planning on taking the course. So I think there'll be a little crux of people who will be taking it. Then I think the next thing is to develop protocols for some common conditions. Oh, thank you. Okay. Like headaches, like nausea, like vomiting, like sickle cell pain, like dental pain. Things that, you know, unless we think about ahead of time, you know, we may not approach very well. This will also involve, and I have another slide about this, partnering with our doctoral people in acupuncture who are now starting to work in the hematology oncology department and had very extensive training. We have Epic documentation that's kind of nascent for the ED, but it's being developed on a broader level. Billing is a little bit of a joke because you get $7.30 for a treatment, but nevertheless, we do need to keep track of what we do. We need to make sure that the quality is good, and we need to think about research. So Idi documentation is found under snapshot. The first thing is the consent, and the consent form, oh, it's not on here. The consent form is very general, and patients sign it, it's scanned into Epic. Then we have a little smart phrase that is the same that's used at UCSF by their inpatient service. And it just evaluates various things of the patient's condition and then describes what kind of things that the practitioner did and what the response was. But hospital-wide, I think we've got a lot of work to do that could be very exciting. So we already have an inpatient pain team that Dr. Steve Long, one of the anesthesiologists, runs. It's very labor-intensive. It sees about 140 patients a month so far. He and some of his colleagues are the only ones, and right now it's based mostly on narcotics and other analgesics. So that may be some other place where we and other acupuncturists can contribute. We need to recruit our community resources. There are 4 physicians who are associated with the Acupuncture and Integrative Medicine College in Berkeley that gives doctorates. They have 3,000 hours of training compared to our physician 300 hours of training. And so we need to partner with them to help us develop these protocols and work with them. They are going to be working in the Hem-Onc clinic. And so there'll soon be a natural transfer of information. We need to collaborate with UCSF. There are 2 hospitalists at UCSF who have a clinic that is open 2 days a week, on Fridays all day and on Mondays for half a day, and that's Dr. Karen Sun and Cynthia Kim. They also took this same course about a decade earlier. And then we would like to develop an outpatient pediatric pain clinic on site, as much for emergency department patients who may need a little extra oomph for their conditions, as for people with chronic pain conditions. And not the least of which is the huge effort of Dr. Jen Matthews, who started a medical staff committee for integrative medicine, and there are a lot of very dedicated people on this committee who are interested in eventually making this work. So that's it. Any comments? I mean, that's yeah, Michael.
Yeah, I'd just like to add that there are other aspects of doing acupuncture. You know, we talk about acupuncture in physics is a lot by transferring positive and negative electrons. So a large part of acupuncture these days also is creating that current, and there's several ways of doing it. Augie talked about twiddling the needles to make a current, but we also use a machine that actually puts out a current. So for a lot of things, we will be connecting electrodes to the needles and to a positive electroneutral, and causing a current for up to 20 minutes, depending on what type of acupuncture you're doing. And then acupuncture also is not only just acute, in the Western philosophy, in the Eastern philosophy, there's things that we do for acupuncture to increase chi generally. So people who are just low energy, there's certain acupunctures, things that you do to increase chi or increase their energy. And a lot of these things involve using an electric current with the acupuncture.
I think a little more so in the medical approach to acupuncture than in the traditional acupuncturist approach. Yes, yes, absolutely. Yeah, yes.
When discussing acupuncture with pediatric patients, do you find that it produces anxiety and a little bit more fear? How do you deal with that?
I can't profess to know about this because our program is nascent. The only people I've done anything on are the sickle cell adult patients. There are plenty of videos about this where people talk about tapping, the needles, about tapping, and generally, often people do not use needles at all with children. So, yes.
When
when we did the study in the ICU, I think it was like in 2003, most of them were teenagers, because I think we had 25 or 27 that were post-op spinal fusions, but we had 3 or 4 general pediatric surgical patients. One was like a 20-month-old who had abdominal surgery, and so she couldn't use needles. It was Mary Stewart, who was one of the heads of the Berkeley Acupuncture Project. She is the sister-in-law of Dr. Shelley Wu, and that's how Shelley was able to do this project while she was a fellow there. She had these little tiny gold tools. One looked like kind of like a gold bowling pin, and another looked like a tiny gold rake. And she was literally just stimulating the meridians, not having to leave anything on. And in all the patients we had objective vital sign changes. They went to sleep. They did not need their pain medicine. How we did it in the spinal fusions was we waited for 24 hours, so we had a baseline of their use of their PCA. Then they got a treatment. They used no narcotics for 8 hours. The next 8 hours it started to climb. The last 8 hours they were back to their baseline. They got a second treatment, and it was repeated. I mean, it was really, really fascinating.
Oh, it sounds like a wonderful
2 of
study.
our patients became hypotensive and had to have fluid boluses, but you know, those spinal fusions are already a little dry to begin with. But it was really fascinating, in fact, because we only had, I think, 27 patients, or maybe 27 spinal fusions, and these few pediatric patients. It wasn't statistically a large enough study.
Right, and that's what usually happens, but the effects are,
we also interviewed the parents, and would they be willing to pay for this if it weren't covered, and they all wanted it, they wanted it right now. It's like, well, we can't do it right now because this is just a research, we're just gathering, but thank you for letting us know that you think it's a valuable treatment mode for your child.
Michael.
I just got a great idea from Dr. Kim, one of our pediatric surgeon, who has a foot clinic. And so he does foot surgery on people, and he has to inject the kids and stuff like that. And he's using virtual reality goggles. And he's saying it's been a godsend that, he can numb the kids up, which is a very painful thing when you're doing foot stuff. To numb the kids up, and they don't even, they're so involved in their virtual reality goggles that they don't even.
They're doing that at UC. At UC, they have Child Life has VR goggles. They're implementing all of that in the ED when they're, setting. Yeah, it really works.
But that's something we can consider, even if we have to pay for it.
Well, and kids in general, I think those people who do pediatric acupuncture feel that all these meridians, and as you can imagine, nothing's blocked off, so it doesn't take much. Just like with animals, I mean, people do acupuncture with animals, and no cat is going to run around with needles in them. I mean, they basically they respond. So I think that's well, I guess more later. Next time, Michael will talk. Thank you for listening, guys. Thank you for coming.